Hi, my name is Dan, and today I'm going to be talking about aripiprazole, which has a brand name of Abilify. Aripiprazole is an antipsychotic medication, but it's used for depression as well. Historically, antipsychotic medications have known to work by blocking dopamine because too much dopamine can cause psychosis, so blocking that helps treat the psychosis. But dopamine is a feel-good chemical that the body uses and can increase happiness. So you would think by blocking dopamine, it would decrease happiness. But Abilify or aripiprazole works a little differently than some of the other antipsychotic medications. So it's a dopamine partial agonist, or sometimes called a dopamine stabilizer. So in theory, what this would do is when dopamine levels are too high, like in psychosis, it would bring them down. And when dopamine levels are too low, like in depression, it would bring that up and potentially stabilize them. It also has effects on serotonin as well, just like other antidepressant medications do, but it hits different serotonin subtypes. So it can block serotonin 2A, which is actually associated with an increase in dopamine in certain parts of the brain, and then it blocks serotonin 2C and serotonin subtype 7, which can help with circadian rhythm and then also help with depression there as well. Aripiprazole can be used for a few different conditions. So it's used for depression, it's used for schizophrenia, it can be used for bipolar sometimes, it can be used for autism. But when dosing for depression, it's usually on the lower end of the scale, so from 5 to 15 milligrams daily. It's normally tolerated pretty well. Compared to other antipsychotic medications, it doesn't have a lot of metabolic risks, so like weight gain and changes in blood sugar and changes in cholesterol. One of the notable side effects that stands out with Abilify is a side effect called akathisia. So when you see a patient with akathisia, it's like an intense internal restlessness. So I've been interviewing patients before with akathisia, and they will stand up, sit back down, stand up, sit back down, walk around the room while you're talking to them. They just have that internal drive to get up and move. Other than that, though, there aren't a ton of side effects with aripiprazole, so it's generally well tolerated. So aripiprazole was the first medication in this class, the partial dopamine agonist or the dopamine stabilizing class. So it really gained a lot of ground in the market, so it's pretty commonly used. It's important to note that for depression, it's approved as an adjunct, meaning like an add-on medication to a patient that's already on an SSRI, say, or an SNRI antidepressant. So maybe someone who's been on a medication or two, they're getting some benefit, some response, but they're looking for a little more, then this could be a potential add-on. So there are some negatives to that as well. So that's taking more medications, that's more costs at the pharmacy. But if these options are something that you can still go for, then aripiprazole could be a good choice to help treat your depression. So this wraps up my overview of aripiprazole that has a brand name of Abilify, and I hope that was helpful.